second and third trimester ultrasound. That is a mix-up of basics and some advances. The concept was to have a review of the basic things and then discuss the advanced things. So this is the anatomy of the female body while she is pregnant. Here is the cervix, the internal os, external os. Here is vagina. Is the uterus, which is gravid, and there is a fetus. This is placenta, the transabdominal scan, and amniotic fluid inside. The first question is why we perform ultrasound in second and third trimester. The first thing is gestational age assessment. Then we have placental localization, cervical assessment, diagnosis of multiple pregnancy, detection of fetal anomaly, and psychological assurance of the parents and family, especially the mother. First is gestational age. The gestational age we measure by ultrasound is better than the accuracy which we get from last menstrual period or the date of the last menses. That is the first day of the last menses she had before getting pregnant. Decrease in post-maturity rates. If we know the dates, we will be knowing that things are going beyond 40 weeks of pregnancy and we can deliver the baby before there are complications of the post-maturity. Decrease in induction rate. Sometimes if the dates are confused, the obstetricians or LHVs or midwives can try to induce, and even there were some cases reported that induction was done in 7th or 8th month when there was minimal facilities or no facilities of ultrasonography, or there was lack of competency in the health professionals for assessing the age. Nowadays, in most of the countries, even majority of LHVs, the lady health visitors, can perform ultrasound to such extent that they can know the age of the fetus by measuring BPD and femur length. And they can see the presentation and placenta. So decrease in induction rates due to gestational age assessment and accurate knowledge of gestational age to correlate with other test results. For biometry, we measure BPD, which is the biparietal diameter. These are the parietal bones, then is the falx cerebri. So we need falx equidistant from each parietal bone. This is parietal bone, equal distance. From leading edge to leading edge at 90 degrees to falx. Either we take outer from here or outer from here. So according to protocols, we must measure one side of bone while having the BPD measurement. So if this side of bone is more clear, I will put the cursor at the outer side of this moon, and then I will have to put it here.